From your Gulf Coast Weather Authority, this is Fox 26 Morning News.
With the popularity of shows like Extreme Maker and Nip and Tuck, nose jobs, facelifts, and other cosmetic procedures have become common among everyday people. But in light of the economy, are people choosing to cut back on elective surgery? Our next guest joining us from St. Luke's Episcopal Hospital, he's plastic surgeon Dr. Etai Funk. Good morning.
Good morning. Thanks for having me.
Well, thank you for being here. I'm kind of curious. I mean, you know, everyone is scaling back right now. Are they scaling back when it comes to plastic surgery?
There has been a significant decline in cosmetic surgical procedures. Survey results from 2008 have confirmed that. However, on a positive note, we've seen a significant rise in minimally invasive and non-invasive type procedures such as Botox, fillers, and skin treatments. And I think this economic downturn, this economy, and just basically the stock market and the uncertainty of our retirement funds, people are a little down, a little depressed, and they need a pick-me-up. They need to feel good.
Right.
And I always believe that looking good is feeling good, and truly people are looking for affordable alternatives to continue to look good and feel good about themselves.
But even with these non-invasive procedures like Botox, for example, could still be very expensive. Have you seen the prices come down?
They haven't quite yet, but there are competitors that are coming out with Botox, and I think we're going to see probably a price war with Botox and fillers and things of that sort in the future.
What are some of the other things that people are choosing to continue to do right now?
Sure. Well, with this rise of the minimally invasive type of procedures, you know, people are really looking at Botox, fillers, and skin treatments. And I think
so. Usually things mostly for the face.
Mainly for the face, absolutely. And I think when it comes to Botox, I always tell my patients there's two things they got to keep in mind to get more bang for their buck. And that's number one, when you're getting your Botox injection, always ask how many units you're getting injected, because we're not measuring Botox in milliliters or in syringes. So it's important to know how many units. And number two is, when was this Botox reconstituted? When was it mixed? Because the makers of Botox state you need to use it within 4 hours after reconstitution. And although other studies have shown that it retains its potency within 1 to 2 weeks, so patients should ask, when was this mixed? And I always mix my Botox the same day of injection, save it for a week in case they need a little touch-up afterwards.
All right. Well, Dr. Etai Funk, thank you so much for coming in. As we can see, a lot of people definitely getting that procedure. So thanks for the great advice.
Thanks for having me.
All right.